Hello, this is Marla Dalton, Executive Director and CEO of the National Foundation for Infectious Diseases, or NFID. This month, only 1 year after the novel coronavirus, SARS-CoV-2, first emerged, we are beginning a national COVID-19 vaccination program in the U.S. Joining me today is NFID Medical Director Dr. William Schaffner to answer some frequently asked questions about COVID-19 and vaccines to prevent it. So, Bill, thanks for joining us. The question that many want to know are what are the key differences between the various types of vaccines to prevent COVID, and should certain individuals choose one vaccine over another once they become available?
Well, hi, Marla. Good to be with you as always. At the moment, we have one vaccine that has an emergency use authorization. That's the Pfizer vaccine, and another one, the Moderna vaccine, which is on the docket to actually receive its EUA tomorrow. So I think soon we will indeed have two vaccines. There's nothing much to choose between them. They're entirely similar. They're both mRNA vaccines. They're both two-dose vaccines. They're both somewhat reactogenic, as we say, and that means they have a tendency to cause sore arms. And some people the next day will be feeling kind of puny, as I like to say, a little fatigued, and may have a headache and may even have a degree of fever. That's the immune response, of course, working on the vaccine. And those symptoms last for a day or two. You have to get two doses. They should both doses be from the same manufacturer. The major difference between these two vaccines is that one, the Pfizer vaccine, has to be kept very, very cold. So it's going to be distributed to major medical centers where they have the capacity and the dry ice and the training and the freezers to handle the vaccine. The Moderna vaccine, although it has to be kept refrigerated, is much easier to distribute. And I suspect that's the vaccine that state health departments are going to send out to rural areas and to pharmacies and doctors' offices. So when your time comes and we'll get the information who's to get the vaccine when, please go to your healthcare provider and get vaccinated.
Perfect. What is the recommended timing between the two doses?
So the Pfizer vaccine is 21 days and the Moderna vaccine is 28 days. So it's either 3 or 4 weeks. You don't want to do it shorter, and I don't think the providers will give it to you at any time much shorter than what I've indicated. But if you happen to have that second dose delayed for one reason or another, don't worry, just go in and get the second dose. You don't have to repeat the first dose.
Great. So for how long are the vaccines effective? I guess more importantly, will individuals need to be revaccinated each year?
That's one of the most frequently asked questions, to which there is a resounding, well, we don't know yet. We will have to watch and see for how long the protection from these COVID vaccines lasts. And as they used to say on the radio, stay tuned, because information will be forthcoming from the CDC and state health departments. It may well be that we have to get periodic re-immunizations. You know, we have to do that with our tetanus vaccine already, and we get flu vaccine each year. We'll have to see what the regimen is, if one is needed.
Indeed. So the million-dollar question, Bill, is when will vaccines be available for the general public? And specifically, what are your thoughts about children?
Well, we need to know what the general public is. At the beginning, we're going to be giving it to, and we have started already, to give it to healthcare workers, excuse me, and residents of long-term care facilities, nursing homes, the people who not only work there, but the people who reside in those facilities. And then next, according to a plan which is about to be approved by the CDC, it will be extended to either people age 65 and older and those younger who have underlying chronic conditions, or to that very large group of what has been called essential workers, people who keep the society as we know it functional. Whichever is chosen, and there are no right and no wrong answers. Let's just make sure that the people who are next in line get it, and then beyond them, folks who are younger and who are otherwise healthy will be in line. This is a process that will take quite some time. As I like to jest, we can't vaccinate 330 million people in the United States in a week and a half. This will take months, so it's a long-term activity. Now, children. Children were not included in the first set of trials. They were restricted to people age 16 and over. This is the population, of course, that was more severely affected, and that's why that was chosen. And it was also thought to be ethically more appropriate to first try these new vaccines on adults before we tried them on children. Trials in children have just been started. I would anticipate they would be completed sometime in the early summer, and then we'll get recommendations for the use of the vaccines in children.
Great. It sounds like our new mantra may be Rome wasn't vaccinated in a day.
Right.
The other question we receive often is, how do we know that these vaccines are safe?
Well, we know they're safe because they've been studied in very large groups of people, 15,000 in each of these large clinic, and even larger in these clinical trials. So that's a very substantial experience, and the people who've been vaccinated have been followed for a minimum of 2 months, and the vast majority of reactions, based on our whole experience with vaccines of all types, occur within that time period. So there's really a lot of confidence that these are safe vaccines. Now, mind you, they are reactogenic, as I said, and so some people think of that as side effects, but that's just part of getting the vaccine itself. I think the question really has to do with more serious side effects, and so far, none have come up. Perhaps a little footnote. We now know, based on the experience in Britain, as soon as they started to be used, if you have had a serious allergic reaction to any previous injected medication or vaccine, then we need to deal with you, if you get this vaccine, in a cautionary way. We want to make sure that if you get the vaccine, you're under observation for 30 minutes, because in people who have had serious allergic reactions, and I mean anaphylaxis, people who've had difficulty breathing and a drop in blood pressure, these are the people who carry EpiPens. There have been 2 reactions in people with that medical history in the UK. So we learned from that right away. We're going to deal with folks who have those characteristics in a special way, should they wish to receive the vaccine.
Okay, I'll ask the next one because I think it's important to be on the record with, but is it possible to get COVID-19 after receiving the vaccine?
I think it probably is possible to get COVID-19 after receiving the vaccine, because these vaccines are said to be 95% effective, not 100. And there were a few cases, very few, that occurred in vaccine recipients in the trials. The risk is very, very low. I mean, these are vaccines that are wonderfully effective, better than we anticipated. Now, that does mean that even after we've been vaccinated, we have to keep wearing the masks and doing social distancing. And then there's also another reason we have to do that. The trials were designed to show whether the vaccines prevented illness, and they certainly do that, and that's wonderful. They were not designed to show whether they prevented infection. Those studies are underway. We'll get information about that, but at the moment, we don't know whether you can be vaccinated, still have an infection, and be contagious to others, even though you're protected from disease. So that's yet another reason why masks are still with us, along with the social distancing.
And clearly we know that it is not possible to get COVID from the vaccine.
Oh, goodness, no.
Perfect.
These vaccines are, if you will, made from only a tiny little part of the vaccine, of the virus, I beg your pardon. And so you cannot get COVID from the vaccine for sure.
Thank you. And before we end, Bill, I'll ask you the crystal ball question. And do you see a return to normal gatherings and events in 2021? Do you think individuals will be required to show proof of vaccination in order to return to work or school?
Well, as to the first question, that all depends on all of us. If we come forward, roll up our sleeves and get vaccinated, and we can achieve something better than 70% vaccination, I think that that will give us herd immunity, that will help reduce the transmission of the virus and flatten the curve. And so by next Thanksgiving, it could be an almost normal Thanksgiving again. But we'll all have to come forward, and those who are a bit skeptical will have to be reassured and persuaded to come in and be vaccinated. Now, as to mandates of one form or another, they certainly can't be imposed federally at the national level, but there's been a lot of discussion back and forth. I wouldn't be surprised if here and there we don't see an employer saying something like, well, if you want to fly on X airline, you have to show you've been vaccinated. And incidentally, we can all do that in our personal lives. If you want to come to Thanksgiving dinner at grandma's house, bring your vaccination certificate with you.
I think that's a perfect way to end, Bill. As always, thank you so much for shedding light on a continually evolving topic. I know we'll be back with more questions soon, and thank you all for listening. Have a wonderful day.